Welcome back, everyone, to another MedVarsity Deep Dive. Today, we are going deep on preeclampsia.
Okay.
But we're not just talking about, what is it?
Right.
We've done that before.
Yeah.
This is about complications.
Ahoo.
This is about when things
Yeah.
really go wrong.
Yeah.
And
That's a good
what
one.
really stood out to me right off the bat is how preeclampsia is not just a blood pressure thing.
No,
It affects
definitely not.
all these different systems.
It's really a multi-system disorder.
Right.
We're talking kidneys, liver,
Mm-hmm.
brain.
Yeah.
And that's why I think it really takes a team to manage this.
And that's where it gets interesting because
Yeah.
I saw nephrologists,
Yeah,
gastroenterologists.
absolutely.
It's not just OB anymore.
It's a whole team effort, right?
Yeah.
And it's not just the specialists involved.
Yeah.
Even the treatments themselves can be a little unexpected.
Yeah.
For example, when preeclampsia progresses to eclampsia, now we have to be prepared for seizures.
Right.
You might not think of it, but morphine can actually be used.
The morphine. Really?
Yes.
That's not the first thing that comes to mind
I know, right?
when I think pregnancy complications.
But it's all about managing those seizures.
Okay.
Morphine helps to control them,
Got it.
which is absolutely crucial in an eclampsia emergency.
And even something as simple as patient positioning
Yes.
becomes super important
Absolutely.
to prevent aspiration.
Right. And that's because, remember how we talked about liver involvement?
Right.
Preeclampsia can cause liver dysfunction, which can lead to nausea and vomiting. Now, combine that with seizures, and suddenly the risk of aspirating vomit becomes very real.
Yeah, that is a scary thought.
Absolutely.
So let's talk about those renal complications.
Yes.
Specifically, acute renal decompensation.
Right.
What does that even mean?
Good point. Acute renal decompensation basically means a sudden drop in kidney function. It's like the kidneys are struggling to keep up with their job.
Okay.
Filtering waste,
Yeah.
maintaining fluid balance.
So the way you manage that
Mm-hmm.
depends on the severity.
Right.
It said that sometimes. No treatment is needed.
Yeah.
That was surprising to me.
It can be, but sometimes if the kidney function is only mildly affected
Okay.
and the overall picture is stable, we might just monitor things closely.
Got it.
But if there's a significant decline,
Yeah.
then we need to act fast.
So you're watching things like,
We'll keep a close eye on creatinine,
Right.
uric acid levels. Those are markers of kidney function.
and sometimes you might use diuretics.
Sometimes we might use diuretics,
Okay.
medications that help the body get rid of excess fluid.
Now, this is what I thought was fascinating. Spontaneous diuresis after delivery.
It's actually quite fascinating.
What's going on there?
After the placenta is delivered,
Yeah.
there's often a natural surge in urine output. The body seems to reset itself.
So it's like the body knows what to do once the pregnancy is over.
It really highlights the connection
Yeah.
between pregnancy hormones and kidney function.
But of course, things don't always go smoothly,
Right.
and sometimes you even need hemodialysis.
Unfortunately, yes.
That's serious stuff.
Hemodialysis becomes necessary when the kidneys just aren't recovering
Hmm.
and complications start piling up.
Like what kind of complications?
We're talking about severe acidosis,
Mm-hmm.
dangerously high potassium levels,
Okay.
fluid overload, and uremia,
Right.
which is a buildup of waste products in the blood.
So dialysis is basically buying you time.
Dialysis helps to take over the function of the kidneys,
Okay.
filter the blood, essentially buying us time for the kidneys to hopefully recover.
Now I want to shift gears a bit.
Okay.
This was new to me. The research on serotonin
Yes.
and preeclampsia. This is a newer area of research,
Yeah.
but it seems that increased serotonin levels
Mhm.
might be a piece of the puzzle. Serotonin is a neurotransmitter,
Right.
but it also plays a role in blood vessel function. So could this lead to new treatments that target serotonin?
Possibly. It's still early days,
Okay.
but understanding the role of serotonin could open up new avenues.
Another area that stood out, anesthesia.
Yes.
Why is that such a...
It all comes down to the fact that preeclamptic patients
Mm,
are in a delicate physiological state. Their cardiovascular and respiratory systems are already under stress,
right.
and anesthesia can add another layer of complexity.
It's like walking a tightrope.
Exactly.
So to wrap things up, preeclampsia, it's not just about high blood pressure.
It's more than that.
It's about...
It's about understanding the interconnectedness of the body
Right.
and being prepared to address a wide range of potential issues.
Early recognition,
Senpai.
prompt intervention,
Yeah.
a multidisciplinary approach.
That's key.
This is a team effort.
It is.
So my final thought for you.
Yeah.
Imagine you're on that team, managing a preeclampsia case. What questions would you ask? What areas would you want to investigate further? Keep that curiosity alive. And join us next time for another MedVarsity Deep Dive.